Can we start now, Doctor?
Yes, you can.
Okay. Okay, so Bismillahirrahmanirrahim. Okay, so today I will present about the PBL 10 trigger 1. So for the fact, Sarah, which is a 23-year-old female, came with a sign system of persistent nervousness, palpitation, weight loss, heat intolerance, fatigue for the past 3 months, having difficulty sleeping, and inability to focus. So for the idea, our possible diagnosis involve two systems, which are the central nervous system and endocrine system. So for the central nervous system, we make it to as the anxiety disorder as well as substance abuse. And for endocrine system, hyperthyroidism and hormonal imbalance. So what are we going to be investigate is the anatomy and physiology of each system, pathophysiology and etiology of each possible diagnosis for each disease, sign and symptoms and risk factor of possible diagnosis for each disease. So for our action plan, we want to study the anatomy and physiology for each system involved, to discuss the pathophysiology and etiology of each disease, and to investigate the signs and symptoms and risk factor for possible diagnosis for each disease. Okay, so this is the trigger 1, which is the Sarah, 23-year-old female, presented at the health clinic as she is experiencing persistent nervousness, palpitation, weight loss, heat intolerance, and fatigue for the past 3 months. And she also complained of having difficulty in sleeping, and her academic performance is dropped due to inability to focus. Okay, so I proceed to my friends.
So the nervous system is involved in receiving information like sensory function and sensation and generating response to the information like motor function and response. The nervous system coordinates two integration, which is the central nervous system and peripheral nervous system. The central nervous system is composed of the brain and spinal cord, while the peripheral nervous system is composed of spinal nerves that branch from the spinal cord and cranial nerves that branch from the brain. Next. So the brain is an important organ that controls all functions of the body. The brain is located within the skull. The brain receives information through the 5 senses, which are sight, smell, touch, taste, and hearing. It assembles the messages in a way that has meaning and stores that information in the memory. The brain controls thoughts, memory, and speech, movement of the arms and legs, and the function of many organs within our body. So the brain has 3 main parts, which are cerebrum, cerebellum, and brainstem. The largest part of the brain is cerebrum, which is composed of right and left hemispheres. It performs higher functions like interpreting touch, vision, and hearing, as well as speech, reasoning, emotions, learning, and fine control of movement. Each hemisphere controls the opposite side of the body. In general, the left hemisphere controls speech, comprehension, arithmetic, and writing, while the right hemisphere controls creativity, spatial ability, artistic, and musical skills. Next is the cerebellum, which is located under the cerebrum. Its function is to coordinate muscle movements, maintain posture, and balance. The last part of the brain is brainstem. It acts as a relay center connecting the cerebrum and cerebellum to the spinal cord. It performs many autonomic functions like breathing, heart rate, body temperature, weight and sleep cycle, digestion, sneezing, coughing, vomiting, and swallowing. Next. So the hormones involved are dopamine and cortisol. Dopamine function as neurotransmitter, which chemicals that relay messages between nerve cells in the brain and from neurons to muscles and help to coordinate movement and control mood and cognition. Cortisol is a primary stress hormone which increases sugars or glucose in the bloodstream, enhances the brain's use of glucose, and increases the availability of substances that repair tissues. So the cerebral hemispheres have distinct features which divides the brain into lobes. Each hemisphere has 4 lobes, which are frontal, temporal, parietal, and occipital. The frontal lobe covers personality, behavior, emotions, judgment, planning, problem solving, speech like speaking and writing, body movement, intelligence, concentration, and self-awareness. The parietal lobe interprets language, words, sense of touch, pain, temperature, interprets signals from vision, hearing, motor, sensory, and memory, spatial and visual perception. Then the occipital lobe interprets vision, including color, light, movement. Last lobe is the temporal lobe, which understands language, memory, hearing, sequencing, and organization. So next is the peripheral nervous system. So sensory cells carry messages to the central nervous system. Then motor cells carry the signal from the central nervous system to the internal organs, muscles, and glands in the periphery or the outer edges of the body. Peripheral nerve cells are either somatic or autonomic. The primary role of the peripheral nervous system is to connect the central nervous system to the organs, limbs, and skin to allow for complex movements and behaviors. For somatic nervous system, it has somatic nerve cells includes sensory nerves that carry messages from the outer areas of the body, having to do with the sense and motor nerves that are responsible for voluntary movement. For autonomic nervous system, it is divided into three separate divisions called the parasympathetic, the sympathetic, and the enteric divisions. Next, the sympathetic division increases body functions. It prepares the body for stress-related activities or increased physical activity through actions such as regulating blood vessels. It is activated when we are faced with stressful or high arousal situations. It is also called as fight or flight response. The parasympathetic division is involved in slowing body functions. It is associated with returning the body to routine day-to-day operations. It also controls vegetative functions and constant opposition to sympathetic system. It helps the body to conserve energy and it has rest and digest, feeding and breathing functions. To counter the fight or flight response, the system encourages the body to rest and digest.
Okay, so we move on to the first possible illness, which is the anxiety disorder. Okay, so basically, anxiety is a feeling of unease, such as worry or fear, that can be mild or severe. And there are several types of anxiety disorders. Okay, the first one is generalized anxiety disorder, which involve a persistent feeling of anxiety, which can interfere with daily life. Next, the panic disorder, where there are sudden periods of intense fear, discomfort, or sense of losing control, even when there is no clear danger or trigger. And next, the social anxiety disorder, where there's an intense, persistent fear of being watched and judged by others. And last one is the phobia-related disorders, when there's an intense fear of specific objects or situation. So, what happened during the anxiety is that when the people is predisposition uh, to anxiety, there will be imbalance or abnormal functioning of norepinephrine, serotonin, dopamine, and also gamma aminobutyric acid or GABA. So what happened is that the hippocampus and cingulate gyrus abnormally process straight. So when there will be two things happen, which is the first one is the activation of hypothalamus pituitary adrenal cortex axis, also known as HPA. When uh, uh, it describes the interaction between the hypothalamus, pituitary gland, also adrenal glands. So when the HPA axis is stimulated, the hypothalamus responds to signals like elevated norepinephrine levels by secreting the corticotropin releasing hormone into the bloodstream. So corticotropin releasing hormone, also known as SRH, increase the activity of the sympathetic nervous system and perpetuating the effects like elevated heart rate. So CRH also tells the pituitary gland to secrete a substance called adrenocorticotropic hormone or ACTH, and the pituitary gland will release the ACTH into the bloodstream, and the hormone will travel down to the adrenal cortex. So ACTH bind to receptor on the surface of adrenal cortex, leading to a series of intracellular events that result in the adrenal gland secreting glucocorticoids like the hormone cortisol. So next the activation of the autonomic nervous system and adrenal medulla. And so basically the adrenal medulla is the glandular extension of the sympathetic division of the autonomic nervous system. So when the sympathetic division is activated in response to stress or threat, the medulla releases two substances, which are the epinephrine and norepinephrine into the bloodstream. So from this to activation, the stress, so basically the stress hormone interact with brain and body in various complicated mechanisms. Means it will the it involves us the how the body react due to the activation, both activation. So the significance, basically the significant mediators of anxiety in the central nervous system are thought to be the norepinephrine, serotonin, dopamine, and also GABA. So for the etiology, anxiety disorders are like other forms of mental illness, and they do not come from personal weakness, character flaws, or problems with upbringing. However, researchers don't know exactly what causes the anxiety disorder. However, they suspect a combination of factors plays a role. So the first one, the chemical imbalance, when there is severe or long-lasting stress, can change the chemical balance that controls mood, which when a person experiences a lot of stress over a long period, it can lead to an anxiety disorder. Next, the environment factors. When a person experiencing a trauma, it might trigger an anxiety disorder, especially when in someone who has inherited a higher risk, and also the heredity. Anxiety disorder tend to run in families, and the people may inherit them from one or both parents.
No. Okay, so after the stimulation of autonomic nervous system, sympathetic nervous system, it will produce the response or symptoms such as nervousness, restless, and tense. Or patient will have the sense of impending danger, panic or doom, having an increased heart rate, breathing rapidly or hyperventilation, sweating, trembling, feeling weak or tired, and trouble concentrating or thinking about anything other than the present worry. Next is the risk factor for developing the anxiety is if the patient is having trauma or PTSD, or patient is having other mental illness such as depression, or patient with substance abuse, or using any substance that can disturb the chemical balance in the brain and the central nervous system. And then patient who have the high alcohol consumption also will develop a high risk for anxiety disorder. And then for patient who having the family history of mental disorder will have the high risk to develop the anxiety disorder.
Okay, next is substance abuse, which substance abuse is one of the types of substance use disorder, which according to DSM-4 of American Psychiatry Association, substance abuse can be defined as faulty adaptation of using substances as evidenced by recurrent and unfavorable results associated with frequent usage of substance. Substance abuse also an insistent and repetitive application of the substance despite solemn health-related problems. Next, these are the types of substance which there are depressants of CNS like benzodiazepines, barbituric, rapinol, and ketamine. Next is CNS stimulants, which this substance together with opiates and opioids strongly stimulate the brain's reward system and decrease the rewarding effect of normal behavior, which is like cocaine, amphetamines, methamphetamines, nicotine, and even caffeine. Next is opiate and opioid narcotic analgesics like morphine, narcotin, codeine, tibane. Next is cannabis, like marijuana, which is derivative of cannabis sativa plant. The active ingredient is delta-9 tetrahydrocannabinol TC, which contain more benzopyrene than tobacco. Next is hallucinogens.
which they cause change in state of observation and misinterpretation of reality, like LSD, lysergic acid diethylamide. Next is inhalants, which reduce the body function based on the quantity used. They affect both CNS and PNS. So their chemical contents are absorbed into myelin sheath, then that lastly lead to polyneuropathy, like aerosols, nitrous oxide. Next. Next is the etiologies for substance abuse, which the person might, because of lack of family involvement, parental supervision or support, family disruptions such as divorce, acute or chronic stress, and also heavy psychiatric disorders such as conduct problems and major depressive disorders, and also substance use among peers and time spent with substance, and also exposure to physical, sexual, or emotional abuse or trauma. Next.
Myra, for people
Yeah.
with anxiety, what type of drugs that we give?
Benzodiazepine.
Again, what is it?
Benzodiazepine.
Benzodiazepine. What else? Do we give opiates to anxiety disorder people?
Mm,
Can we use them in combination? Or is it only one single treatment?
can.
When do we really use them? Like, is that all possible for treating the depression or anxiety? Not sure. It's okay. It's okay. No problem.
Sorry,
You can
doctor.
continue. Yeah, that's fine.
Next, for the pathophysiology. So, the usage of drugs such as cocaine, which is the CNS stimulants, will increase the amount of dopamine in synaptic cleft by inhibit the dopamine transporter. When the dopamine transporter is being inhibited, it will stop the reuptake of dopamine and allow it to stay extracellularly, which causing the prominent changes at molecular, cellular, and behavioral level. So, drug addiction has been termed as disease because the drugs cause permanent changes in the dopamine reward pathway of the brain, lead to compulsive use even after the initial pleasurable effect of the drug has worn off. So, the repetitive use of the drug leads to craving and withdrawal symptoms, which lead to continuation and maintenance of the drug abuse.
Okay, so moving on to the signs and symptoms for substance abuse. The firstly is the strong urge, desire, or crave to retrieve and use the substance. So those involved in the substance abuse will have the feeling that they need to take the drugs daily, needing more of the drugs to get the effects of it, and then willing to get the substance by any means. Probably, for example, by stealing it and so forth. Next is social issues. So they may be withdrawn from family, friends, and community activities, unable to complete their task by meaning that they have loss of attention and loss of focus. This causes poor academic performance, and also they have trouble with money issue, like they can't control their money well, and for example they tend to buy more drugs even they have no money, and changes in behavior such as violent outbursts and increased impulsivity and risk-taking behavior, and physical the changes in physical appearance. They may be appeared as to be neglect in their own personal hygiene, lack of energy and motivation, drastic changes in appetite and weight, and also this may cause trouble in sleeping. Next. So the risk factors would be the same as mentioned prior by Humaira. So those who have family history of addiction have a high risk factors in developing substance abuse and mental health disorders, because using drugs is a way of coping with their painful feelings such as anxiety, depression, and loneliness. Example of mental health including ADHD, depression, and PTSD. Peer pressure may also contribute to the use of substance abuse. Lack of family involvement or parenting guidance. This is due to various reasons such as difficult family situations. Next.
Okay, next, for the endocrine system. For the anatomy and physiology of endocrine system, endocrine system is a control system of thymus gland that secrete chemical messenger called hormone that circulate within the body via the bloodstream to affect distant cell within the specific organ. So the involved hormone are focused on body growth, sexual development, and function secreted into the bloodstream, and it gives effect to the targeted organ. So hormone act as a messenger and carried by the bloodstream to different cells in the body. So there are 7 major organs for endocrine, which is hypothalamus, pituitary gland, thyroid and parathyroid gland, adrenal gland, pineal gland, and also reproductive organ, which is ovary and testicle. Okay, so first hypothalamus, which are located towards the base of the brain, below the thalamus, which is a part of the brain that relays sensory information, and above the pituitary gland and brainstem. It is about the size of an almond and responsible to maintain homeostasis and also respond to a variety of signals from the internal, external environment, including the body temperature, hunger, feelings of being full up after eating, blood pressure, and level of hormone in the circulation. So hypothalamus secrete the hormone thyrotropin release hormone and gonadotropin release hormone, growth hormone, corticotropin release hormone, dopamine, and also orexin. Next is a pituitary gland, which are located at the base of the brain beneath the hypothalamus. So this gland produce hormone that control many functions depending on the hormone released by the hypothalamus. So pituitary gland is divided into 2 lobes, which is the anterior lobe and posterior lobe. So the lobe of pituitary gland release different hormones. So this is the hormone by pituitary gland, which follicle stimulating hormone that stimulate the age maturation in the ovary and release of sex hormone. Luteinizing hormone stimulate the maturation of age and the corpus lutein surrounding the egg, which affect the female sex hormone and menstrual cycle. But the thyroid stimulating hormone, it stimulate the thyroid to release thyroxine. Adrenocorticotropic hormone causes the adrenal gland to release cortisol. For the melanocyte stimulating hormone, stimulate the synthesis of skin pigment. Growth hormone will stimulate the growth during infancy and puberty. And antidiuretic hormones stimulate the kidney to conserve more water, and lastly oxytocin, which affect childbirth, lactation, and some behavior. Okay, so for the thyroid and parathyroid gland, so thyroid.
So again, what's the relation between the hypothalamus and also the pituitary gland?
What I understand that the gland when the hormone released by the pituitary is depend on the hormone released by the hypothalamus. For example, like when the hypothalamus release the GnRH, which is the growth hormone release hormone, then the pituitary gland will stimulate the release of the LH and FSH hormone that acts on the ovary and testicles.
Hypothalamus itself is an endocrine gland or not? Or is it part of the brain?
It's part of the endocrine gland.
Is it part of the nervous system as well, hypothalamus?
Yes. Yes.
Yes.
Yes.
So you got like two functions, yeah, at the same time.
Yes.
Okay, so now the information or the hormones that be released by hypothalamus be stored in a like a pouch-like, we call it glands, yeah, and that we have the pituitary gland. But some, the pituitary glands doesn't have this only one glands. They have two, right?
Yeah. Two.
Yeah. So which one belong to which? FSH belong to which one? Which part? The anterior or posterior? So you have to mention that because they have two different cascade or information. The different pathways,
If it's
right?
this,
Anyone? FSH, anterior or posterior?
anterior.
LH?
LH also anterior.
Okay. TSH?
TSH I think anterior.
TSH anterior.
Yes.
ADH? ACTH?
CTH also anterior.
MSH? Melanocyte?
Melanocyte anterior.
Yes, is it anterior?
I think anterior.
Okay. GH?
GH anterior.
ADH?
Posterior. Oxytocin also anterior. Posterior.
Posterior. So what's the difference? Why some of the hormones they are located in the posterior while some others in the anterior? Why? Why do you think? Or they can travel, or they can choose between anterior, posterior, or any location that they want. What makes them really, being specified in the specific location? Have you think of that? Why?
Because their action is different for the anterior and posterior.
Again, Azmi?
Because the action is different for anterior and posterior. For example, anterior lobe is called adenohypophysis. This lobe produce response to hormones that come from hypothalamus to the vessels that connect them.
Okay, very good. So you need to know that this is a multiple step process. So they need to translate the information. Because if you can imagine, if everything started from the hypothalamus and you have a hypertension, for example, and they will act immediately and directly on the specific organs. So if there's only one way, okay, if it's only one way from hypothalamus, and there is a blood vessel to carry all the hormones directly on the heart to regulate or to reduce the heartbeat, for example. If that's the case, means if it's only one way, not through steps, it's quite dangerous to the body. Okay, so we need time sometimes, and of course, why they've been separated is because they are different way in they have a different routes, they have different different channel. If you can see that the vasopressin and oxytocin, they are located on the posterior, and this is for more further down location, okay, quite far location, while the anterior is more towards the upper parts of the body, generally speaking, okay. So you can see they are using two different routes, and the most pathways that we are interested in is the one that being regulated through the anterior. That's the most, because that's the bigger glands as compared to the posterior, and also there's more targets organs, and they have more branches of roots, channels, or hormones that they can secrete. So it always relates to the capacity of the hormones, and also the way or the steps that they need to regulate the homeostasis. If it's too direct, we have a direct effect. We have a direct stimulating hormones. I forgot the images, but I can try to find it. There's some hormones that can give a direct effect, okay? But some of these that you mentioned in the box here, they are through the cascade or steps in order to give the function. All right. Okay, so make sure every time when you mention about the pituitary gland, go to the anatomy and discuss the, which one is belong to anterior, which one belongs to the posterior. That's it. Okay, continue.
So next is thyroid and parathyroid gland. So thyroid gland located immediately below the larynx on each side of and anterior to the trachea. So it made up of two half called lobe that lie along the windpipe trachea and are joined together by a narrow band of thyroid tissue known as isthmus. So it produces thyroid hormone that regulate the body metabolism, bone growth, and development of the brain and nervous system in the child. So for the parathyroid gland, is a two pair of small gland embedded in the surface of the thyroid gland. So one pair on each side. So parathyroid gland release parathyroid hormone, which regulate the calcium level in the blood and bone metabolism.
And the thyroid functions to what?
So for the thyroid, regulate the body metabolism and bone growth and development of the brain.
So you have to differentiate between the function of thyroid gland and also the functions of thyroid hormones. Okay, don't get confused. The thyroid gland is only for storing, for storage. Okay, for the thyroid hormones is what we are interested in. So you have these T3 and T4 hormone, isn't it? So generally, when you speak about the thyroid hormones, what are their function? Anyone? Yes? Again?
Body metabolism.
Yes, very good, brilliant. So the first thing when we talk about thyroid, always what should be in your mind is metabolism. Okay, the first thing when we mention about the thyroid, the first thing is the metabolism. That is what they do. Failure of the thyroid gland to secrete thyroid hormones can cause the metabolic disorders. All right. Okay, maybe we want to focus a bit more on this. Continue.
Okay, so for the thyroid hormone, so the gland will release the T3 specifically, which support the brain function, heart function, and digestion, and also play a role in the metabolic rate and bone health. And then thyroxine is responsible for the metabolism mood, and body temperature. And lastly is calcitonin, which decrease the blood calcium level by causing calcium to be deposited in the bone. And also calcitonin is made by the so-called parafollicular cell found in the connective tissue between the follicle. Okay, for the thyroid hormone regulation, so the hypothalamus will signal the pituitary gland to produce THH, and then THH will signal the thyroid to make T3 and T4, and then the level of thyroid hormone in body then feedback to the hypothalamus and the pituitary, which in turn adjust the release of the THH. So when the level of the thyroid hormone, which is T3 and T4 drop to low, the pituitary gland will produce the TSH, which stimulate the thyroid gland to produce more hormone. So under the influence of the TSH, the thyroid will manufacture and secrete T3 and T4, thereby raising the blood level. So the pituitary sense this and respond by decreasing its TSH production. So pituitary gland is regulated by the hypothalamus. Hypothalamus produce TSH and then tell the pituitary gland to stimulate the thyroid gland. Okay, so this is the picture of the thyroid hormone regulation, which when the T3 and T4 concentration in blood is low, hypothalamus will release the TRH, and then this will trigger the TSH released by the pituitary, and then after that, effects of the TSH release will trigger release of the T3 and T4 by thyroid follicle cell, and then effect of the T3 and T4 release will increase the basal metabolic rate of body cell and rise in the body temperature. Okay, next is pineal, adrenal, and reproductive organ. Pineal gland is responsible to secrete